Welcome to Kwaderno Academy, empowering excellence through education. Join us as we inspire growth and unleash your potential. Let's dive in.
Hey, welcome. If you're a new PT or maybe you're internationally educated, thinking about your first day in a skilled nursing facility, well, it can feel like a mix of excitement and, maybe a little bit of what am I getting into? So today we're going to pull back that curtain. We're going to walk through what a typical day actually looks like, from that first morning huddle all the way to the final note. Ready? Let's dive in.
Right? It's the big question on every new therapist's mind. You've read the textbooks, but what does the day-to-day really feel like in an SNF? The actual rhythm of seeing patients, doing the paperwork, and working with the team. We're going to break it all down step by step. Okay, so first things first, let's get on the same page. A skilled nursing facility, or SNF, as you'll hear it called, it's not a long-term nursing home. The best way to think of it is as a crucial bridge. It's where patients go for that really intensive short-term rehab right after a hospital stay, often covered by Medicare Part A, so they can get their strength back and get home safely. So, before you even glance at your schedule for the day, it all starts with understanding who you're there to help. Because in an SNF, a truly great treatment plan, it begins with knowing the person, not just their diagnosis. And you are going to see an incredible variety of cases. One minute you might be working with a patient who just had a total hip replacement, and your very next patient could be regaining their ability to walk after a stroke. You'll also be helping people who are managing really complex conditions like heart failure or diabetes. What this means is you get to use a huge range of your clinical skills every single day. So what's the big mission here? Honestly, it's all about function. It's about getting people moving safely again, getting in and out of bed, walking down the hall, tackling stairs. It's about improving their balance to prevent falls. And this is so important, it's about training caregivers and family members so that when they go home, it's a safe and successful discharge. Okay, so how do you manage all of this? Look, a successful day in an SNF doesn't just happen by accident. It really starts with a focused, strategic morning game plan. All right, here's a bird's eye view of what a pretty typical day might look like. You see it kicks off early with a team huddle, then you move right into a big block of patient care, and then you wrap things up with documentation. This timeline, it's the structure, but it's your clinical judgment and your flexibility within that structure that really makes the day work. That first hour is absolutely critical. First, you're syncing up with the whole team, getting safety updates. Then, you're looking at your caseload for the day to prioritize. Who needs you most urgently? Maybe it's a brand new admission or someone who's getting ready to go home. And then you're diving into the charts, checking for new orders, looking at lab results, and making sure you know every single precaution before you even step into a patient's room. Okay, you've got your plan in place. Now it's time for the heart of the work, the hands-on patient evaluation and treatment. This is where you really connect with your patients and put all those clinical skills into action. So, how much therapy are we talking about? Well, typically, patients get therapy 5 to 7 days a week, especially right when they arrive. And this brings up a really, really important point about modern SNF care. Under what's called the patient-driven payment model, or PDPM, there are no fixed minute requirements for Medicare. This is huge. It empowers you, the therapist, to decide how long a session should be based completely on what the patient needs clinically and what they can tolerate, not some reimbursement target. So this is basically your PT toolkit in the SNF. You'll be using everything from therapeutic exercise to build strength and endurance to really specific functional training, like practicing how to get from a bed to a wheelchair. And hey, look at that last one, family education. That is not an afterthought. It's a core part of what we do to make sure that discharge is safe and successful. A patient's success isn't just about what happens in the therapy gym. It's really propped up by a ton of background work, solid documentation, and just as important, seamless teamwork.
Documentation. It doesn't have to be super complicated, but it absolutely has to be defensible. So here's the bottom line. Your notes have to clearly answer why this patient needs a skilled therapist like you. They have to show real objective progress with data, and they need to describe how the patient responded to what you did. This is how you tell the story of their recovery.
All right, let's talk about the P word, productivity. Seeing a number like this, 408, can feel a little intimidating, but let's just demystify it for a second. If you've got an 8-hour day and your target is 85%, that just means 408 minutes of billable time. It's simply a measure of efficiency. It's to make sure you're spending the bulk of your day doing what you're there to do, caring for patients.
And that time with patients is delivered in a few different ways. Now, most therapy is one-on-one, individual, but you can also use group sessions, that's you with a few patients at once, or concurrent sessions, where you're treating 2 patients at the same time who are doing different things. The big rule to remember under Medicare Part A is that group and concurrent therapy, when you add them together, can't be more than 25% of a patient's total therapy time for their stay. This just makes sure every single patient gets plenty of that crucial individualized attention.
I've got to stress this. You are never working alone in an SNF. Your interdisciplinary team, the IDT, is your greatest asset. Seriously, think of them as your success multiplier. They are your partners in creating a complete, holistic plan for every single patient. And here's a look at how that team fits together like puzzle pieces. While you're focused on getting them walking again, nursing is managing their pain and their medications. The OT, or occupational therapist, is zeroed in on daily living activities like dressing and bathing. And social services is already planning for a safe discharge. When everyone is talking and unifying their goals, guess who wins? The patient. Every time.
You'll also get to know a few different insurance payers. Most of your patients will probably be under traditional Medicare Part A, but you'll definitely see Medicare Advantage plans, Medicaid, and private commercial insurance too. The key takeaway here, just always verify authorizations and get to know the specific rules for each payer you're working with. So, after a full day of treatments and teamwork, it's time to wrap things up. And you want to finish the day with that same strategic focus you started with in the morning. That last hour of the day is really for finishing up any notes. A pro tip is to micro-document throughout the day to avoid a huge pileup at the end. But it's also for setting the stage for tomorrow. You're checking on any equipment needs, confirming plans with the rest of the team, and just making sure everything is perfectly in place for your patient's continued progress. So there you have it. That's a map of the day-to-day routine in a skilled nursing facility. The schedule gives you the structure. The team gives you the support. So the final question really is for you. Within that framework, how are you going to bring your unique skills, your compassion, and your expertise to provide the kind of care that truly changes lives?
Brought to you by Kwaderno KO. Learn smarter, not harder.